needed, so I needed to give them boosters. And I found out that over the years that a lot of drugs that were used for other purposes were actually being found out to be helpful in cancer, and that they were actually supportive in cancer therapies, regardless of whether it was a natural therapy or conventional therapy. It would enhance the success rate in these patients.
Okay, so now off-label drugs, you can get them basically over the counter or maybe on Amazon, is that right?
Some yes, some no.
Okay.
It depends on the drug. Some of the drugs have to be prescription.
Okay.
There's a diabetic drug, metformin, that has to be prescription, and the patients need to know that they can only take this with food so that their blood sugar doesn't sink too much. But sure, well, some of the off-label drugs, for example, Tagamet, which everyone knows for the stomach, actually helps to raise the immune system. The immune system activity is not as helpful in chemo, but there are other drugs that work well in chemo. In fact, I have an entire list here, but I'll just, skim through a few of them. I mean, even aspirin, which is over the counter, is very helpful in cancer. And I use low-dose naltrexone, which was an opiate receptor inhibitor, and that is prescription, but that was only recently found out. I can't say that recently, but it was recently shown how it worked. It's been used for over 10 years, but I was very skeptical about it because it did not have enough information. Now I know it helps immune system, so that's one that I give. The metformin is prescription. And believe it or not, we use sometimes doxycycline, which is an antibiotic, and we sometimes use an antiparasite, mebendazole. Mebendazole has a mechanism also in tumors in itself. So some of the compounds that I use that are prescription will not only affect the tumor itself, but very often we have accompanying pathogens like parasites or bacteria that are also helping tumors to grow. So very often what we're seeing is that if we give some of these other drugs for parasites or for bacteria, in addition, that we have a double hit on the tumor. It hits the tumor itself in certain mechanisms involved, but it also will affect the pathogens that are helping tumors to grow. So these are very interesting new studies that are actually showing that the patient, well, it depends. There's two ways that I do it. Either I give zeolite, which is a cage-like structure that actually pulls out the heavy metals into the gastrointestinal tract. Or I do what Dieter Klinghardt used for years, and I've actually done it on myself and on my patients. We use coriander in the morning and chlorella in the afternoon. And the coriander pulls out the heavy metals into the hepatic circulation, and then in the afternoon the chlorella pulls out the heavy metals into the gastrointestinal tract so that they can be eliminated.
So what you would give someone with a solid tumor. So can we go to colon cancer and lung cancer?
Yeah, colon cancer, as I said, is very, very often associated with a parasite and also fungal infections. So what we do is we shift the patient's diet. Aspirin actually helps in colon cancer too. I had a colon cancer patient in New York, and I sent him to a colleague who is one of the top parasite specialists for the United Nations, and he's actually in New York on Fifth Avenue, and helps in all the cancers basically. But lung is a little different. In lung, actually, I've had to use an off-label drug called statins, which I don't particularly like. They're a cholesterol drug, and it has nothing to do with cholesterol. Brain tumors, however, feed off of cholesterol, but I don't give them statins either. I have a whole list of natural substances, and we'll discuss that later in cholesterol, that can lower cholesterol in the blood to help to reduce feeding a brain tumor. But in lung cancer, we found that statins hit another pathway in their tumor growth. And I actually used that in a stage 4 non-small cell lung cancer in combination with coenzyme Q10, because it does lower it in the heart. And we used metformin on her. We use cyclophosphamide support on these patients for specific nutrients that work at major areas in tumor cells. I never believed this before. I used to think that herbs and spices and foods were just something for our daily meals. I never realized that they can also be anti-cancer. And what we're finding out that it's extremely important for the immune system. So this is why my patients are on probiotics. This is why my patients are on organic foods, and slowly but surely we're replacing the bad bacteria with good bacteria to help to get their immune systems up, and it's working. It's working well.
What other types of off-label drugs do you use on disease?
Okay, as I said, sometimes it depends on the disease. Sometimes I use dipyrimidol. It's actually a drug used in neurology. Dipyrimidol I use for triple-negative breast cancer, and I'm just reading this here. It actually works on an inflammatory pathway. It's the adenosine pathway, and so it appears to be helpful. As I said, I give. Well, I'll read through the list here so you can see some of the things that I'm giving. Sometimes we give Someta, which is a bisphosphonate. Now, Someta, most people think of that are colleagues of mine say, oh, well, that's just if you have osteoporosis. That's not true. Someta is now being found out. It's a bisphosphonate that helps to put calcium back into the bones. But we found out that what it also does is it helps to get those, they're called macrophage 2s. They're the bad guys. And the macrophage 2s are in tumor cells and help tumor cells to grow. We found out from the literature and from a lot of research that Someta will actually help to push those macrophages out of the tumor cells and stop the tumors from growing. It's a very interesting work. I'm doing this right now in a pancreas cancer patient. I try to talk my colleagues into giving this to him because I want him to have this. And a lot of the clinics won't follow what I say because they don't do research. And I do research, and my patients get well, and their patients get buried. And I really am sick and tired of this. It's time to get more patients healed. We do use CBD oil. But not always, and it's not allowed in Germany. It's allowed in England and in America and many of the states. CBD oil, you don't need a lot of the THC in there at all, in fact. CBD oil is a hemp oil that actually works on inflammation on the tumor cells. So it's very helpful in cutting down inflammation on tumor cells.
I had a doctor that talked about inflammation and cancer, inflammation and disease. Now, would you say that the CBD oil is the best you can use for inflammation?
Well, no, not necessarily. In fact, basically speaking, there's at least a half a dozen substances that work against inflammation, and very often, if they're combined, you get much better efficacy. Aspirin works on inflammation. Curcumin works on inflammation. Boswellia serrata or frankincense works on inflammation. Palmitoyl ethanolamide works on inflammation. That works on special receptors, inflammatory receptors. CBD oil works on inflammation. So as you see, there's a myriad of things that work on inflammation that when they're combined, you're really down-regulating that stimulus for tumor growth because they don't have that inflammatory parameter anymore. Lipoic acid, which has anti-cancer activities anyway, but it's anti-inflammatory. It's a sulfa. Everything, including the off-label drugs and the low-dose naltrexone. For pain, I put her on PEA, et cetera, and by God, she has no more cancer. Sal, this stuff, it's amazing, but that's what it's all about, and that's why I took my oath. That's why I studied 56 semesters, and that's why I'm now a professor up at the university.